Good afternoon, everybody. Thank you so much for joining us. My name is Ann Thompson. I'm the Assistant Director for Public Services here at the Essex Library, and I'm honored today, completely honored, in fact, almost in an overwhelming way, honored to welcome Dr. John Schreiber from Connecticut Children's Medical Center, and also Elizabeth Michelle and Hillary Maynard from Hartford Healthcare, and they're going to present COVID-19 and kids safety today. A lot of great information is going to come out. Some housekeeping just to begin with, though. Please keep your microphones muted for the time being. We are making a recording of this so it can be available afterwards, and keep your cameras off so we preserve that extra special bandwidth. We will take questions at the end, though. If you think of them, please go ahead and type them into the chat and we'll get to them afterwards. It may be that we're a small enough group, you'll be able to unmute your microphone and verbalize your question afterwards, but one way or the other, we'll get to all the questions this afternoon. And with that, I will hand it off to Elizabeth Michelle. Thank you.
Wonderful. Thank you so much. And it is such a pleasure to be here with you all today. Over the past several months, there's been so many, a year and a half, honestly, there's been so many questions, and it's always a privilege to be able to come in person or virtually and be in a setting where we can have a very open discussion. And so that is our goal tonight, is to have an open conversation, to have your questions answered. There's no question that is too unimportant or too spicy for our conversation. So please feel free to just share what's on your mind and to ask the questions that you have. My name is Elizabeth Michelle, and I'm the Health Equity Specialist at Hartford Healthcare. And I am joined by Dr. John Schreiber, who's the Interim Chief of Pediatric Infectious Diseases at Connecticut Children's. What you can expect tonight, we'll start off with 20 to 25 minutes of a moderated discussion. So we came with some questions prepared for Dr. Schreiber, and he'll answer those questions. And then afterwards, we'll spend the bulk of the rest of the time answering the questions that you have. So as you heard before, please feel free to put your questions into the chat box. If you'd like to come off mute, we should be able to do that as well. If you'd like to ask your question directly, it's always fun to hear folks' voices directly if you're comfortable doing that. And then another option is, if you'd like to keep your question anonymous, you can send your question directly to me via the chat, and I'll be happy to read the question out loud without sharing your name. So with that, again, please feel free to ask whatever questions you have. We really want to have this space and create the space for you. Our main focus is thinking about kids, youth, and parents as parents are making decisions for their children. All right, so let's kick it off. Dr. Schreiber, want to make sure that we're all on the same page. Can you, at a high level, tell us which vaccines are authorized and approved in the US and which ones are approved for children?
Sure, and thank you for inviting me, Elizabeth and Ann, and the whole team at Essex Library. I really appreciate it. I welcome the chance to get out in the community as much as I can and just talk to people, because there's so much information flowing, a lot of it correct, a lot of it not correct, and it's important to talk it out and feel comfortable with the information that you're getting. And so I really appreciate being here. I also want to start, before we get started, I've been a pediatric infectious disease doctor for decades now, and I approach all of these issues as, what would I do for my own family? I'm a parent. I'm a grandparent now, which is kind of exciting and fun. And it's really fun because you kind of get to have all the fun, then you get to leave. And it's just amazing. Any grandparents out there, you know what I'm talking about. It's just such a privilege. But that ends up changing the way you think. And so I always try to analyze risk benefit in my head. So what would I do for my own family and why? And then share that with the audience of what's my thought process and why did we go ahead and do that for my own family or not? And so that's kind of where my head's at. And I just want to explain that before we get going. So Elizabeth, I'll let you roll. I know you have a bunch of questions that you wanted to.
Yes, no, thank you for that introduction. Always incredibly helpful for that perspective. So we'll start off with which vaccines are authorized and approved in the US and which ones for children.
Sure. So we have 3 vaccines in the United States that are used for COVID-19 right now. You've got the Johnson & Johnson vaccine, which is a single dose vaccine down to, I believe it's 18. And so that vaccine has not been authorized for children yet, although I know they have data and they're submitting some of that to the FDA. And that's a different technology. That vaccine uses a virus that's basically made very weak to shuttle in the genetics for the spike protein, and then your cells make spike protein and you make an immune response against it and you become immune to COVID. The two other vaccines have similar technology. What they've done is they've taken the RNA, which is the genetic code for proteins, and they've made it into a little package with some fats, some lipids. And then that's the vaccine. And then you take that in and it doesn't go into your nucleus of the cell. It just goes into the surface of the cell. And you make proteins that are the virus proteins, spike protein, same thing. And you make antibodies to that and you become immune. So the Moderna vaccine is one that's given 2 doses over 4 weeks, and that's licensed down to age 16. And then you've got the Pfizer vaccine, which is licensed down earlier to 12. And so those are the 3 vaccines available. 2 of them are identical technology, but different companies and slightly different doses. And one of them is a very different technology. Now, there is a 4th vaccine that probably will be coming out this winter called Novavax. And that's a vaccine that's more traditional. It's the same way our hepatitis B vaccine is made and other vaccines. And what they do is they basically grow up spike protein in bats, and it's actually in insect cells. They purify it, and then you get that as the vaccine. So stay tuned for a 4th vaccine that's more traditional that probably come out this winter sometime. Now, for children, there's more to your question in that the FDA has just be starting to see Pfizer data down to age 5. And Pfizer has given it to 2,500 children. They followed all their antibody titers and whether there are any side effects, and they think it looks great. And they're presenting that to the FDA in the next few weeks. And the FDA and the CDC will have to decide, is it safe and effective in those age groups? And if so, how will it be released? And the Pfizer vaccine that's being used in children in those clinical trials is about 1/3 the dose of the regular Pfizer that you or I got as an adult. So that's the vaccine scenario. I will say the Pfizer and Moderna vaccines have been remarkably effective. They sort of have been a lot better than I think people really thought they would be. And an illustration of that is Connecticut. So we have COVID right now, but there's just not a lot of people in the hospital, in the ICU. And we've had only a very sprinkling of people pass away in the last couple of months. And we're way up there, 70, 80% of people have been fully vaccinated. If you go to Mississippi and some of the other states where most people are not vaccinated, 1 in 350 people in Mississippi has died from COVID. The ICUs are full. It's just terrible. And so the vaccines work, and New England is just an illustration of that because we're in a better place. I won't say it's back to normal, but it's moved a lot more in that direction for us than in a lot of the rest of the country. So that's the broad picture from 5,000 feet, Elizabeth, of the vaccines.
That's great, Dr. Schreiber. Now, you mentioned a couple times the word technology. Can you unpack that a little bit? Is there some hardware that's being used in the vaccines? What does technology mean?
Yeah, no, there's no hardware. And it's a great question because there's been all this flurry about, nanoparticles getting injected that can track you and all this. And I will say, I have done a demonstration for some of my other talks. You can find the smallest GPS tracking device made by the CIA or whatever. And it's way too big to fit in a needle. It's just not possible. So let's just put that over there as not factual. But the technology that's being used for the RNA vaccines is actually about 20 years old. There have been clinical trials since the early 2000s. Like I said, you take the genetic material that encodes the protein, you coat it in lipid, and you use that as the vaccine. It's been about 20 years, but this is certainly the largest clinical trial because we've given it to 250 million Americans and another couple 100 million all around the world. So it's been given probably the largest clinical trial in vaccine history ever. But that technology is about 20 years old, and it's not as traditional as the one where you just grow up the virus and you kill it, or you grow up the proteins of the virus and you inject that into people as a vaccine. It's a little bit different technology, but there's no hardware. And the RNA, after you inject it into a person, stays around about 2 days, and it's very unstable, falls apart quickly. It's one of the reasons the vaccine is frozen. And then your body makes spike protein and you make good immune response against it. And that spike protein hangs around about 2 or 3 days as well. And it's been measured and it goes away. So it doesn't hang around your body and cause long-term immune issues. It goes away pretty quickly. And it leaves your immune system pretty smart in case it happens to see the COVID virus. You're already primed to be fighting against it and not get very sick from it. So.
Great, thank you. So I want to tap into your parent, grandparent hat a little bit. As a parent or a grandparent, what do you feel are the like the pieces of things that folks should think about, or you encourage parents to think about as they're navigating the costs, the benefits, the risks of identifying whether or not to vaccinate their children? Like how it's such a scary thing to think of our kids and have to predict long-term, 10 years from now, am I still going to be happy that I made this decision for my child today? So how can we help parents think through this decision?
So, Elizabeth, I really like the way you phrase that, because it's sort of how as you think about it as a parent, it's exactly what you're thinking, how you phrased it. So I want to step back and what do we know about the actual virus infection itself for children? And there's a lot of media stuff on this. Kids don't get sick. Governor of Florida said that, who cares? Kids don't get sick. Well, actually, that's not true. They get sick, but much less possible, much lower level than adults do. Less of them do. So for example, if you look at elderly, maybe if you're above 75, you have around a 5% to 10% chance of dying of COVID. That's very significant. If you're a child, it might be 0.1%. Okay, but oh, it sounds great. It's nothing, right? Well, if you infect 10 million children, that 0.1% death rate all of a sudden is a lot of kids. And if it's your kid, it's a lot of kids. So if you look at COVID nationally, about 400 to 500 children have died from COVID nationally. And it's the same sort of numbers game when you look at who ends up in the ICU, adult, elderly. Oh yeah, they're the ones unimmunized. They get very sick. They can be in the ICU, and a much smaller percent of children do. But when you infect millions of children, a lot of them end up in the ICU. And let me show you, I'll give you an example of that. And this is how, again, you have to have this thought process. So if you go to Arkansas Children's Hospital is full of kids with COVID and the ICU, and they've had some deaths. And the reason is everybody in Arkansas is sick. All right, they didn't have enough immunization, so it just burned through the community, and thousands of people are infected. And so that's what happens when you have an uncontrolled epidemic. If you move to New England, where we've been careful and people in general have been, you put on your mask, you're careful, most people have gotten immunized. We don't have that wildfire spread right now. And so Connecticut Children's, we're seeing about 1 or 2 children a week admitted for COVID. It's manageable. Most of them have done okay. And so we're in a very much better place because of immunization. So I'm thinking, I look at Arkansas and Mississippi, and I don't really want my kid to get COVID. I don't like the odds of, even if it's a really small number, I don't like the odds of getting very sick in the ICU or losing my child to this virus. I don't like those odds. So then they say, okay, what's the vaccine like? What's the safety record of the vaccine? And actually, we have incredible data on that, both because of the size of the numbers of people we've given to the United States and now in the teenage age groups. And also from Israel, where they've given, it's mostly Pfizer, and they have a single system where they can really figure out what everyone's doing. And most recently, they followed 800,000 people who got the vaccine. And there is one side effect that they're seeing that's more than normal, and that is a mild inflammation of the heart that can happen usually in males who are around 17, 18 years of age. And it goes away in a couple of days, and almost all kids do fine with it. And that's about the only side effect they've seen that stands out as making you sick. But if you get COVID and you're a child, the chances of getting that heart inflammation are actually 10 times greater than the chance you would get it from the vaccine. So I'm thinking about all this in my head. And then the risk benefit for my family falls very strongly in, I want to get my kids and my grandkids immunized. I don't want to lose a child. I don't want the child to, and the other thing I didn't mention to you is we don't really understand, this is a very unpredictable virus. So for example, in our division of infectious disease, Connecticut Children's, one of our members lost her brother, who was 40 years old and completely healthy, and just died from COVID, got sick, and 2 days later didn't make it. Nobody knows why. And that's happened to a sprinkling of children across particularly the southern states now. I know there was just a news report about a baby who passed away. Might have been Texas, I don't remember. And so it's happening, but it's not common. And some of the kids who are getting better don't feel better. So at Connecticut Children's, we're actually starting a long haul clinic for children because there's so many parents complaining to us their kids have just never bounced back after they had COVID, even a mild case. It's not a lot, maybe it's 4 or 5% of those kids, but that adds up. That's a lot of parents saying my kid didn't get better. So I'm thinking of all this, and I'm saying I don't want to lose a child. I don't want them to get chronically ill. I don't want them to end up in the ICU. So the vaccine looks better and better and better. And we know it works really well. Look at Connecticut. Our ICUs aren't filled and our death rate is very, very low. And look at Alabama, Mississippi, and Louisiana and Texas, and they're all struggling. And they have a lot of deaths. I mean, we lost almost 2,000 people yesterday in the United States, almost all of them in the under-immunized states, and most of those people unimmunized. So I don't want to be there. And I look at my family, and the risk benefit for me falls on let's get immunized. And my daughter-in-law and son agreed. My daughter-in-law got immunized when she was in her second trimester. She waited the first trimester because she was a little nervous, got it the second trimester, and boy, are they glad they did, because the baby's born with antibodies, and that baby will be immune from COVID for months because the mom's antibodies hang around. And once she saw the baby who died in Texas, she's more grateful that she was immunized when she was pregnant, because that baby's now protected. And we have a 3-year-old grandson, and unfortunately will not be included in this round if the 5 to 12 is approved. And we cross our fingers that there'll be more data and he'll be able to get immunized, because we don't want him to get this and then be chronically ill or God forbid end up in the ICU. So these are great questions, Elizabeth. You've heard exactly my thought process and what we've talked to our family about. That's all laid out there.
That's perfect. Thank you so much for sharing that, and very helpful indeed. So you mentioned long-term symptoms or long-term challenges or long haulers in terms of kids who got COVID, but parents are saying they haven't bounced back yet. So we have a question that came in the chat that I'll ask now, since it's very relevant to what you were sharing. What is our current understanding of what those long-term effects are? And are there any ways to treat them? Like what do we see and what do we know for addressing children who are having long-term effects of COVID?
Well, it's a great question. And thank you, whoever in the audience asked that. We don't understand this virus completely yet. This virus is 2 years old in terms of humanity, right? It's never infected a human and it's only 2 years old. So we've learned so much over the last 24 months, but we don't understand long haul symptoms at all. In the adult world, it's a small percent, but many of those people are feeling very debilitated. They're still short of breath. They're tired. They can't walk upstairs. They just don't feel right. And some of them can't taste and smell for weeks, months. And that's a disability. Think about that. You can't taste or smell anything for months. The children have similar sort of things, and probably not quite as severe. Some of them are just tired and don't feel right. There's some shortness of breath in some of them. Some have had disturbances of taste and smell. So it's similar, but a little less intense than the older people who are getting it. But the families are very concerned. As I said, we're starting this clinic really because of demand of our families. We don't fully understand what's going on. There's a brand new paper that just got published that says it might be an autoimmune disease. What do I mean by that? It means that your immune system starts making antibodies against itself. And if backing up a little bit, the virus works by the spike protein. That's the spike protein, and it binds to this receptor that your body has called the ACE2 receptor, and it disrupts it. And the ACE2 receptor is really important in your body for modulating your blood pressure and how your blood vessels work, kidneys work, how your heart works. So we block that. When you get sick, you make antibodies and you block that. But there's the thought that maybe we're also making some antibodies against that ACE2 receptor, the long haul people. We don't understand why, and we don't have a treatment yet. So that's another reason, because we don't understand it, we can't treat it very well. I don't want my children or grandchildren to get it. And the vaccine is becoming really clear what it does. It's very protective. It's really a small number of people get inflammation of the heart. It's very small. I'll give you an example how small that is. The military followed 500,000 recruits, because you can do that in the military, right? I was in the Air Force. That's what, you can tell people, show up at 4 o'clock. You got to be there, and you do it, right? So they followed all these people, and they always have the young kids who are just entering the military. They always have some inflammation of the heart, because other viruses do that. Something called Coxsackie virus does it, and they always have a little bit. Out of that 500,000, they found there were 8 more cases that they thought might be vaccine related than they might normally see. So it's 8 new cases, maybe caused by the vaccine. All those people got better, and out of 500,000 people. So it's a very small number. And so, that's kind of how you have to think. If you look at the 4, 5, 6% of people getting long haul syndrome, and, they might get inflammation in the heart for 2 days and be fine, and you prevent the disease and they never get it, I still fall on, I'm getting the vaccine, and I want my kids to get it and my grandkids to get it, because I have great respect for this virus. It is not a nice virus. I mean, this is very unpredictable. It's killed 600,000 Americans. Find me a virus recently that's done that in the United States. So the media swirls around it, but the reality is it's a very serious virus. And, again, in my experience, 30 years in practice, pediatric infectious disease, the most unpredictable, and one I fear more than most of the viruses I'm aware of. It's not smallpox, it's not Ebola. I get that. But it is killing a lot of people and hurting a lot of people. So again, thought process is apparent. Yeah, I don't want my kid to get this. Let's protect my children any way I can, and the vaccine is going to be probably our best tool to do that.
If a child has gotten COVID and they're eligible for the vaccine, should they get vaccinated?
Yeah, that's a really good question. The answer is yes, and let me explain why. First off, if they were infected last year, they probably were not infected with the Delta variant, which is that new variant that's all over Connecticut, all around the United States, actually. It's 99% of all isolates in Connecticut's Delta. So you might not be very immune to it if you were infected a few months ago. So that's not going to help. If you were infected with Delta, the immunity wanes, just like we know the vaccine is waning over 6 to 8 months. And so, yes, you need to get your vaccine, and you'll be protected for months and months and months with that. So we do recommend, even if you've had COVID, that you get immunized. I like to wait. If the teenager, young adult has had COVID, I wait a month until they're totally better before I would give them the vaccine. But we do immunize people even though they've had COVID, and those are the reasons why.
Thank you. So let's talk a little bit about after vaccination. So if the child has been vaccinated, even adults, what is the purpose then of continuing to wear a mask, continuing to social distance, continuing to be thoughtful about washing hands, not touching your face, etc.? Shouldn't the vaccine be enough?
So that's another great question. And so what we've learned with Delta variant is that the vaccine is enough to keep you out of the hospital and keep you from dying. So it's doing what it's supposed to do, right? You're not going to get very sick, but you can still get the virus and transmit it. That's the problem. So you're immunized, you feel great, but you were at a little party and maybe you've got Delta and you have a little scratchy throat, and you go around other people in the big Y and 3 of them are not immunized and you get them sick, they'll end up in the ICU and 1 of them might die. So that's the problem. So until everyone's immunized and immune, or the community, and there's a lot of community spread still. So look, if the community spread was almost 0, and you're immunized and your likelihood of spreading around is really low, then the mask becomes less important. But right now, our community spread is a lot. It's everywhere. And so you can get it, you won't feel very sick, you'll spread it around. Not everyone's immunized, and they can get very sick. The other problem we're seeing is that elderly, extreme elderly, say you're 75, 80, and you've been immunized, that will wane over 6, 7, 8 months, and those individuals can get a breakthrough infection and get quite sick. So the answer is, unfortunately, until community spread is gone, it's really important that we wear a mask still, because you're immunized, but you might spread it around. But you're unlikely to get very sick from it, which is great. That's the purpose of the vaccine. But we really don't, we'd like to get the community spread under control so we can get more back to normal. We won't do that if we don't wear a mask right now. It's a marathon. Look, this is a marathon and we're in the last 3 miles. So in the last 3 miles, you don't stop. right? It's up, done with the marathon. No, you keep going, you finish the last 3 miles. And that's kind of where we are in New England. We've got this last few miles. Let's get our kids immunized. Let's get community spread down. And then you know what? I don't feel that masks would be very important, but right now we're not there yet, unfortunately. And then the other problem we have is the rest of the country. So, you know, a lot of people coming to New England to see all the leaves, right? And I've seen plates. I saw Texas plates, South Carolina. I mean, who knows if those people are immunized? Are they infected? You know, you're going like, so that's another problem. We have a, you know, it's a free country. People move around. So we're also importing cases all the time. Another reason to wear your mask until the rest of the country gets us a little more under control also.
Mm-hmm. So you mentioned travel, which is literally one of my next questions. You know, we're heading into the holiday season, fall, Thanksgiving, any of our winter holidays. How do we navigate travel, especially with the normal flu season about to hit into gear? What does that look like as a parent?
So, you know, I kind of use the common sense rule. Okay. So you don't want to get infected. You don't want your kids to get infected. And if you're immunized, you don't want to get mildly ill and transmit it around. So, for example, my wife and I went to a wedding in North Carolina that we had to go to. It was the son of a friend of mine who passed away, and I had to be there. I was signing the marriage license and all that. So we got in the car, and you know, we had our N95s with us. We're both high risk and above 65. And you know, if we stopped, we were very careful and washed our hands and wore our mask when we went indoors. Wore our mask when we went indoors. And at the wedding, we stayed out. It was an outdoor wedding. We stayed outside. We did not go indoors. And we, you know, outside is relatively safe. It wasn't that crowded. And ditto when we drove back. So we were very careful, but we also lived, right? We also did what we needed to do, which I think is important. It's a balancing act. Children, you know, our grandson will be coming to visit. He's in the house. He's not in daycare. Both parents are immunized, and he really hasn't been anywhere. So he will be coming, and the risk in that our family pod is low. It's not zero, but it's low. When they go out, they wear masks. And he wears a mask. He's 3. He likes it. He puts it on. They have little designs on it. You know, he likes the one with the giraffe. Puts that on. They make a game of it. It works. So it's relatively low risk. But, you know, for example, we're not taking in family members with 4 kids. We have no idea of their immunization status, and they're all in school and daycare. We probably wouldn't do that. So I think you've got to use common sense. If you're going to travel, driving in the car is probably safer than air travel because you're more in control. Because, you know, airport, you just have no idea. When you're driving, you know when you want to stop, how you're going to stop. You're going to wear a mask inside, which I would still do. If you're traveling with kids, wear a mask when you go inside. If you're at a rest stop, wash your hands after the bathroom, keep the mask on in the bathroom, all of those common sense measures. So people have to live, you know, we're social beings, and it's very difficult not to have those important interactions. It's why it's so important we keep our schools open, by the way, which I know will be one of Elizabeth's other questions. So yeah, travel, but be safe. Use common sense when you travel, and be careful. You know, if you're going to a state where you know there's rampant COVID and the ICUs are filled, I honestly, probably I wouldn't go to that state right now. I don't really want to go to Tennessee where every ICU bed is filled, because I just, you know, if you got sick, God forbid, and you had a heart attack, that you can't get in the hospital. So there's so many reasons not to travel to those states right now. So, you know, if you want to go to Maine and see leaves, it's great, because, you know, Maine's like us. It's pretty much low key. Most people are immunized. So those are the thoughts that go through my head as we talk about family travel and what one needs to do. You know, it's really a risk assessment. How much risk are you willing to take? And do you have unimmunized children in that group? And if you do, our risk level, we tend to take less risk because of that, because we don't want them to get sick, and neither does parents. They decided they don't want them to have COVID. They're working really hard on that, and I mean, they'll probably be successful, knock on wood.
So we are getting close to our halfway mark. I will ask a few more questions, but for sure want to ensure we have ample time for audience questions. So please gear up your questions. Feel free to start putting them into the chat. If you would like to ask a question via the mic, you can use the hand raising feature. It's one of the reactions. If you hit the reaction button down at the bottom of your screen, you'll see raise hand, and we'll know that you're interested in asking a question, or you can just say in the chat, I have a question, and we'll call on you. But in the meantime, I'll ask a few more questions. So one question, Dr. Schreiber, as you know, children have a vaccine schedule that's been established for a while. In the midst of this vaccine schedule, is it okay to get the COVID-19 vaccine in the midst of other vaccines that they're getting? Like what's the safety there?
Yeah, it's another good question. The answer is yes. There's no reason not to give the COVID vaccine as part of the pediatric immunizations. Remember, it's not licensed yet to give under the age of 12. So hopefully we'll have, this question will be very important in the coming months, probably around November, I think, if we're successful getting the vaccine out for younger kids. The answer is yes. And in fact, you can give it with the flu vaccine as well. I do want to mention something to parents, though, and I know this is being recorded as well. You know, we've conquered a lot of these pediatric illnesses that really killed a lot of kids in the old days. And I don't have a slide of it, but I live in a small town, about 1,500 people, and there's a cemetery in town that dates to 1755. And actually, my family's buried there, and I'll be buried there. And that cemetery, and you walk through the old part of it, it's just full of children. It's a cemetery of children, and you'll see 5 kids lined up next to their mother and dads who died way before their parents did. And they were all dying of infectious diseases. You know, these were things that we'd never seen now, like polio or smallpox or diphtheria. And these are things that pediatric immunizations that your kids get have wiped out of the United States. We don't have them anymore. It's a blessing. And when you're a parent now, you expect my kid's going to live to adulthood and be healthy. That's your expectation as a parent in the United States, which is wonderful. That was not true in the 1700s. Your expectation was you'd have 9 kids and probably 2 would make it to adulthood. And just think about that. And the vaccines that we have changed the world for the better, and children live to adulthood, and most children, and it's just a wonderful privilege. That privilege is hard earned by all the immunizations we give to the babies and as they grow up, to keep them from getting meningitis and diphtheria and all the things that used to kill the kids. So getting your regular pediatric vaccines, don't fall behind. We don't want those things to come back in the middle of this pandemic. Could you imagine if we had a polio case? You know, we just don't want that. So get your kids their regular immunizations. It's really important because we wouldn't want to have an epidemic of something else in the middle of this. And yes, you can give the COVID vaccine with those. It's just, the data show doesn't make any difference. It doesn't matter. So there's your answer.
Yes, thank you. And then my next question, going back to the topic on schools, is it safe for our kids to be in person during this time? You know, kids daycares and preschools especially have been known as germ factories, you know. So if we know that there's such a propensity for sickness to get passed on so quickly between children, is it safe for in-person schooling? What advice or what thoughts do you share with parents who are considering how to navigate schooling and education with their kids in this time?
Well, you know, it's another great question, and something we're navigating in terms of this preschool in our house and thinking this through. I want to say, first off, I think it's really important that the schools stay open now. It's been a long year for everyone. It's not, children are meant to be around other children. They're meant to learn things. Their brains are developing, and having them socialized is just so important. So I approach it by saying, how do we keep our schools open as safe as we can? And remember, nothing's 100%. It will not be 100% no matter what you do. So, and I look at that and I look at the data, and there's a wonderful study that Duke University and University of North Carolina did with 100 school districts in North Carolina. And they looked at school districts that where kids were all masked and they were careful about it, and districts that were unmasked. And where the schools that wore masks, there were very few outbreaks of COVID. There were some. Wasn't zero, but it was not much, and they were able to contain it. And the schools that were unmasked had to shut down because so many kids got infected. They ended up getting quarantined, and the schools were in chaos. So, and if you go to Texas and Mississippi and Tennessee and all those states right now that have rampant COVID, a lot of their schools are shutting down, and they don't have any mask rules, and half the people aren't immunized. It goes on. And the schools are shutting down because so many kids are sick. So I step back and say, okay, we're a heavily immunized group in Connecticut. How do we, as best we can, keep these schools open and then make it as safe as we can. And I would basically say wear a mask for right now. It's a marathon. Remember, we'll be over the finish line and we won't be wearing masks. But today, to keep these schools open in Connecticut, wear the mask. I know, you know what? I don't like it either. Sure, the kids don't see the expressions and all that, but it's a lot better than closing the school. That's how I look on it. So I want to keep the schools open. Let's wear masks, and the teachers need to be immunized so we don't hurt some teachers, and they need to wear a mask. There's another great study that the CDC just showed where one teacher in a school district who was unimmunized and didn't feel well, had a scratchy throat, took off her mask to read a story in the classroom and infected 24 children. And they went home and they infected some of their parents and grandparents, and 3 people ended up in the ICU. Nobody died. But one person taking off their mask, knowing they didn't feel well when they shouldn't have been in school anyway, right? So why have that happen? Just wear a mask. Let's be tough about it for a few more months. And as the pediatric immunizations roll out and more parents begin to be comfortable with it, and the kids are immune, my bet would be by this spring, we probably don't need the masks anymore. But the marathon's not done. And I know people are frustrated, and I have parents who are in my face and say, oh, I don't want to wear this mask. I get it, but it will help us keep the schools open. Let's keep the schools open. Let's wear our masks. The kids need to wear a mask for another few months until our immunizations take care of that. And then I think I'm looking forward to next year. I think it's going to be a better year.
Thank you so much, Dr. Schreiber. So we're going to move into our audience questions. I'll turn it over to Anne, who has a few questions. So Anne, if you give us 1 or 2 questions, and then we can continue with anyone else who has a question.
Hi, thanks, Elizabeth. I don't think anybody's going to have the same questions I do. So I'll start off with maybe a couple of, well, the first one is pets. So we've seen in the news how some other mammals are being tested and are testing positive for COVID, particularly dogs and cats. Is there anything that parents should be worried about with their pets?
I think I would take dogs off the table. I don't think they're a relevant risk, and they can be transiently infected, but I don't think they transmit it. So I don't think dogs are involved. Cats can get infected and transmit it to other cats. It's never been proven that they could transmit it to a person. So, to me, again, common sense. If someone's COVID infected in the household and you have cats, probably need to stay away from the cats until you're no longer infectious. That's kind of the thought process. I wouldn't get rid of the pets, and pets are wonderful. Okay, we have pets. I have a dog who keeps trying to walk in the room here. Pets are important, but common sense. And cats can get infected, and cats can spread it around to other cats. So, that's the only domestic pet. Now, mink and those kind of animals can get COVID. Most people don't have pet mink in their house. But, if you have a weasel or a mink and that happens to be a pet, that is an issue. And that would be something I'd be very careful about. But that, again, that's not really relevant to most of the people who would be tuning into this. So cats, common sense. Dogs, probably not an issue.
Okay, thank you. So being in the library, certainly with kids and train tables and other toys in library, we've taken most of those away, but the train table is back. And I'm curious about, with the newer variants coming out, do we need to go back to worrying about surfaces, quarantining books, anything like that? Do you see that as a return?
I think the data show that objects are low risk. They're not zero risk. They're relatively lower risk than somebody coughing on you. So masks first. And then, to me, it's common sense. And actually, Elizabeth brought this up, other infections. And if you look at Connecticut Children's right now, actually, we have many more kids infected with a virus called RSV right now, which is transmitted kid to kid. And so you'd like not to have a rough winter with other viruses, because COVID's still there, and we'd like to not get confused and have our hospitals filled with other things. So, I would wipe them down in between play groups. And again, common sense. I think it's important that children be socialized and that they not be isolated in silos. It's been a long year for everyone. Our 3-year-old, has really almost never been in a play group other than his 2 cousins that were isolated. That's probably not good. And so I think it's important to go to the library, wear a mask, hear your stories, all the enriching things that libraries do, and I love libraries. I mean, all the enriching things that libraries do, and just wipe the toys down in between groups. I mean, I think that's what I would do with those Clorox wipes, and if that makes any sense.
Absolutely. And we've been doing that. So anybody who's listening, if you've been avoiding us, you can come back. One last question is a concern over school sports. And do you see that as something parents, where's your stand on, especially as we go into the winter sports?
Yeah. So, and again, I speak as a parent. So we had two sons, and one of our sons was a jock and the other was not. And neither of my wife are jocks. And so this was a new experience for us to understand sports. And you know what? It was really important to him. And it ran his day. Without him running, his soccer player and getting that stimulation, he really couldn't study. He was just that kind of kid. But when he did, and he was in the sports, boy, he was a great student. And so it's important. And I don't think we should ban it. I think, again, common sense. For example, if you're having a team play, it's very difficult to wear masks outside, and probably it's not worth trying. But if you have 200 people crowding around, not a good idea. So that's kind of how I think about it. They're going to play on the soccer field, but if they win the game and 300 parents come out, half of them with not masks and they're all crowding around the kids, not a good idea. So I would think athletics can be done, but in a way with common sense in a controlled circumstance, so they're not dense crowds around the kids while they play. And then the stands, you have to do your separation and whatever you do on the stands to keep parents safe. So the answer is, I can't tell you if this is CDC recommended. Just giving you what we suggest at Connecticut Children's. Realistically, wearing masks outside when you're working out is not realistic. But if you're in a big crowd outside and you can't keep that distance from people, wear a mask. So, you can make your own judgments on which sports, like wrestling, for example, makes me a little nervous. And that might be one where I might want to have my kid in a mask. I think a soccer game, realistically, it's low risk, not zero risk. And remember, the risk will be when they go in the locker room and they're all crowding around each other. Inside, put your mask back on. But when they're out playing, I just don't see it as a high risk situation, except for certain sports that are, one-on-one for like a full 20 minutes, like a wrestling match. That worries me just a little bit more. It's a great question. There is no right answer for this. I can't, the answer is common sense to reduce the risk as much as you can. It will never be zero.
Great, thank you.
Yeah.
Jim, I see your hand. Please go ahead and ask your question. If you're speaking, we can't hear you.
Somebody's hand is up. I see that. Yeah, it's Jim.
Yeah.
Jim, are you there? It'd be kind of fun to hear your voice, actually. There we go.
Okay. We see you.
Now you have to
but
get
we
off.
Can't hear you.
Is that any better?
Yes, we hear you now.
Great.
Yeah, I know what the problem is. Apologies.
No worries.
I also am a grandfather, but and no grandkids here. I'm coming at this as an employer of about 60 people. We're all architects and we work together fairly closely and in closed space. About half of us have kids. What would be your advice and our protocols? By the way, we are, by coincidence, everybody is vaccinated, or they've said they are. What would your advice be for protocol for us to take care of our colleagues' kids in that capacity?
So I missed, you're talking about your work in the workforce in an office, or are you talking about taking care?
Workforce in the office, worried about the transmission. Can I give it to one of my employees who takes it home and gives it to their kids? Where would you draw the line? Where do you see the risks? And
is everybody immunized or not?
They've said they are. I think we're going to require everybody to be immunized, or any new hires to be immunized. Right. And currently we're all wearing masks, but I'm looking to you to give me some more ammo. I get
I would
pushback,
say,
oh, masks are useless, it's not gonna do anything. Like, I get some of that.
so if it was my business right now, knowing that Connecticut has a boatload of community spread right now, if you go on the Connecticut DPH website, you can see the state map. It's mostly red. And that means there's a lot of community transmission. I mean, it's not Tennessee. It's much better than that, but we have a lot of community spread and there's a lot of cases still. So I always approach is I basically don't want to hurt anybody. And so at the moment, I would say if you're indoors and you're working with people in quarters that are relatively close, I'd wear a mask. And I think you will reduce the risk of transmission if it's a surgical mask in the 70% category, which is quite good. And masks work, by the way, and people, there's all this crazy misinformation. I mean, I go to Connecticut Children's and everyone wears a mask, 100%, and all the parents, kids. We haven't had a single transmitted COVID case in the hospital. It just hasn't happened. And we know we've had some infected people. Masks work. So I don't know where all this stuff happens and it doesn't work. It does, they work, and so I would wear a mask indoors at work right now. Now, I think if community spread drops and the map turns green again, the way it was in July, and July was really nice because there just wasn't very much COVID, but I would probably stop wearing masks. So I would go by the epidemiology, go by how much community spread there is in Connecticut, which is a lot right now. And as that dies off, which I think it will, and then you can relax your indoor mask policy. If you guys go outdoors, and by the way, eating is the big risk. If the cases we've had at Connecticut Children's where we know somebody was exposed because everyone went to a conference room, they had food and they took their masks off for a few minutes while they ate. That's the risk. So to mitigate that, if you can put a bench outside and people can take their lunch outside until it's snowing, obviously, but they can take their lunch outside, that is a much safer option because then you can take your mask off and eat. It's probably fine.
Sure.
But indoors, the big risk is when you take your mask off and you share meals in a small area with people. That is the higher risk of infecting them as well. So yeah, I think you're stuck wearing a mask indoors for a while.
Great, thank you. That helps my
It's not what everybody wants to hear, but the reality is, again, if it's my business, that's what I would do because I want to reduce the possibility of infecting anybody in their family. So
Thank you.
Great. We still have time for more questions. If we have any additional audience questions, I'll give it a few moments. And if not, I can keep on asking Dr. Schreiber questions, keep him in the hot seat.
Whatever you guys want. I see there are a couple of people who haven't asked a question yet. So you have a captive audience. So it's a good time to ask questions that maybe you were afraid to ask anybody else. I'm happy to answer them. And again, I treat everyone as if they were asking a family question. So nothing, well, almost nothing's off limits. There are obviously some things. Okay, go ahead, Elizabeth.
Okay, great. So the question that I have for you is, I'd love to talk a little bit about allergies and reactions to the vaccine. How do you tell the difference between a normal response to the vaccine versus an allergic response to the vaccine after a young person has been vaccinated?
Right, so that's a good question. And the allergy that we have seen very rarely, though, remember I told you it's the RNA and it's covered by this little bit of a lipid, a little fat globule covers it. Some people are allergic to that because it has polyethylene glycol in it. It's very small, but some people are. So what happens? You'll get the shot and you'll get hives, a rash, and it'll be itchy right away. And then they'll have to give you a medicine and it will go away. People will feel better, but you'll have to get the medicine. That's a true allergy. And then you want to go to your doctor and determine whether you should get the second shot or not. And an allergist can help do that. Sometimes they'll do a skin test to figure out what part of the vaccine you're allergic to and that kind of thing. So that would be the only case where there's an allergic reaction. If you get a reaction like the next day and your arm is sore and you have a swollen gland where it was, and you feel like a little bit like you have the flu, that's normal. And that means your immune system is reacting in a good way, making you immune to the COVID virus. So that's not an allergy. And if after the second shot, most people didn't feel well for a whole day, and that's not an allergy either. That's just your immune system making you immune to the COVID virus. So again, the immediate reaction of the first hour of skin rash, hives, itching everywhere, that's an acute allergy. It has to be treated. and you want to seek medical attention to make a decision about getting the second dose of the vaccine. So it's pretty unusual, and it's pretty distinct of when you would be allergic to the vaccine. There are not a lot of medical exemption issues that would keep you from getting the vaccine. There are really very few. And immunocompromised, even more important to get the vaccine, because those people don't do very well when they get COVID. So you'd like to be immune. And it turns out after 3 doses, most immunocompromised make a pretty good response. And that's why the FDA about 3 or 4 weeks ago or a month ago licensed the vaccine in 3 doses for immunocompromised, both Moderna and Pfizer. So, but in general, there's not a lot of medical reasons not to get the vaccine. I'll give you another example. One of our employees who was worried about getting immunized has a clotting problem. He gets clots in his leg, and he's worried about the vaccine. And the Johnson & Johnson vaccine, single dose, very, very, very rarely has caused clots, particularly in women of childbearing age, but it's very uncommon. And that's not true with the Moderna or Pfizer. You just don't see that. But if you get COVID, a lot of people get clots, and a lot of people get pulmonary embolus, and you can die from it, from COVID. It makes your clotting system all haywire. So I explained to him, I said, look, the RNA vaccines don't cause clots, but if you get COVID, you're probably going to get one. You might die. So let's get the vaccine, but don't take the J&J vaccine, because that might be the one that has a rare complication. So each case is different, and you want to talk it out with a professional who knows the field so that they can determine whether it makes sense or not to get the vaccine, because each case is slightly different.
Thank you. And we have a question from Michelle. Michelle asks, do we have an idea if there is a higher transmission rate for unvaccinated versus vaccinated? Meaning, are unvaccinated folks more likely to transmit versus vaccinated?
That is a really great question. And I don't think we know the full answer yet. It was thought initially that unvaccinated had really high titer virus and were more likely to transmit it, and that's probably true. But there have been some vaccinated people who had breakthrough infection who had very high titer of virus as well. So it's not entirely clear. It's one of those things. It's a new virus. We're not entirely sure. I will tell you, though, that unvaccinated have a much higher chance of ending up in the ICU and dying than a vaccinated. And again, you can look at the numbers in Arkansas or one of those states where 90% of the people in the hospital were unvaccinated. 10% were breakthrough infections, and they were usually very elderly, nursing home, debilitated people who's waning immunity from the vaccine. So the answer is we're not entirely sure, probably, but there's some data that contradicts that. But we are sure that unvaccinated will more than likely get sick as opposed to a vaccinated person if they get the COVID virus. So it's a great question, and we're just not entirely sure yet.
So I'd love to ask about alternative methods or choices that folks are considering. So we know some folks have been looking to ivermectin as a medication for COVID. We also know that there are folks who really value natural teas and naturally occurring materials as a tool for maintaining health. How effective are those methods for preventing or addressing COVID versus vaccination?
Great question. Starting with the last part you said about natural, just staying healthy, being well. I think it's important no matter what. So, if you have ways that you stay wellness, and it's your diet's great and you're taking vitamins, that's important. The challenge will be, because this is a new virus that humans have never seen before, it will not make you immune to COVID. Unfortunately, it just won't. And so this virus will attack you if you haven't seen it and you haven't been immunized. So yes, it's better to be healthy, and yes, it's better to practice wellness, absolutely. But it's not going to prevent you from getting the viral infection. In terms of the other drugs, you got to follow the data. And this is where ivermectin got started. And unfortunately, really unscrupulous people push it. And it's really been unfortunate. So ivermectin got started because if you take it in the test tube in really high dose, it'll kill the virus. That's exciting, right? But really high dose. So what it turns out, for a human to have enough ivermectin to actually kill the virus would be 100 times the dose that would make you sick. So this is why people are ending up in poison control centers. They're taking horse doses of ivermectin, and it's more than your body can tolerate, and you get sick. So ivermectin as a drug against COVID is not going to be practical. You have to take too much that will kill you before you kill the virus. It's just not going to work. So unfortunately, a lot of people don't understand that. It's out there, oh, it kills the virus. And so they're taking, but not realizing that it's too toxic. In the amount you would need is too toxic and would hurt you. And so this is pretty classic of a variety of different medicines. If you take too much, maybe it'll work if you took so much that it would kill you, but you can't, right? So ivermectin's not practical, and it's not going to work in doses that you can take that won't hurt you. It doesn't, and there've been good studies of this. It doesn't make you better, doesn't prevent COVID in normal doses of ivermectin. Hydroxychloroquine, it doesn't work. There've been really good randomized controlled trials. It doesn't affect you getting better or not. So in general, these extra things aren't working, and it's being pushed on social media, and actually has hurt a lot of people. And then you've got the vaccine, which works so well and has really pretty mild side effects. And, you know, again, very rare, a few in a million might get inflammation of the heart if you're a young teenaged male, but it's very, and you get better in 2 days on average. So to me, I don't know why people would mess with ivermectin, which is going to make you sick, when the vaccine will protect you almost 90 to 100% from ending up in the ICU or dying. So unfortunately, those extra things have been proved not to work. And that's the reason why ivermectin doesn't work. And it's a good, you know, I could see, oh, it kills it in the test tube, sure, but unfortunately it doesn't work in the body because you'd have to take too much. And so I don't know if there were other ones. Oh, I recently saw that people are now gargling with betadine, and that's going to prevent COVID. And in fact, the betadine company had to put on their website, don't do this.
Wow.
It's poisonous. It's iodine, and it'll hurt you.
Mm-hmm.
So there's just some crazy things out there. I don't really fully understand it. Some of it's malicious, and some of it's just misinformed because people hear one thing, oh, it kills it. And then they run down after ivermectin, not realizing the amount to kill it would be too much for your body to handle. So it's up to us to, you know, ask those questions, answer those questions. And I accept all of them coming in. I try to answer them as honestly as I can. So that's my answer on that, Elizabeth. But
Great.
wellness is important. I mean, if you're well, you're going to fight any infection better. So, but it's not going to make you immune to COVID, unfortunately.
Thank you so much for that. So we have just a few minutes left. We'll ask a question. We'll have a question from Michelle. Michelle asked, I believe more studies have indicated that antibodies are passed through breast milk. Can you confirm this? If so, do we know how effective these antibodies are, or how long they last in the baby, taking into account the breastfeeding mother is immunized?
Right. That's a great question, and a really, really important question. So first off, we do know that COVID antibodies are in breast milk, and we know that the baby will get them. But we also know, if you were immunized, that those antibodies transmit across the placenta, and your baby got some of your antibodies that way as well. So they're born, if you're immune, your baby will be born with antibodies as well, and will be most likely immune also. So immunizing a pregnant woman is important in 3 ways. First off, pregnancy is a risk factor to get really sick from COVID. We don't really understand that, but your risk of ending up in the ICU if you're pregnant is high and you get COVID. So it's really important to get immunized. And then the other reason, I told you, the antibodies go across the placenta, so your baby will get antibodies in their bloodstream, which is fantastic. And then you'll also be in the breast milk, so they'll get more antibodies through the breast milk. So in answer, we don't know how long the baby will be protected. We don't know all of that. But if you look at other infections, the antibodies that go through the placenta hang around for about 6 to 12 months. And the babies tend to be pretty immune to a lot of things because of the maternal antibodies. So I'd say 6 months, you can assume. And I think breastfeeding probably augments that. It adds to it because there are antibodies in the breast milk as well. So if you're immunized and you're breastfeeding, it's A-okay. It's a good thing.
And so for that timing, what if the immunization happened after birth?
Well, it'll still end up in the breast milk. So if it's after birth, the antibodies you didn't have them, so they didn't get to the baby's bloodstream, but the antibodies will be in the breast milk and they will go to the baby. Remember, the RNA is gone in 2 days. The spike protein in the mother's body will be gone in 2 or 3 days. And then it's just your immune response. And so the antibodies will be in the breast milk and the baby will get those and it will be less likely to get severely ill. I can't tell you the amount because there's been no study yet comparing breastfed babies to mothers who are immunized to breastfed babies to mothers who were unimmunized in the terms of how many got COVID. That study hasn't been done, so I couldn't give you a number, but it makes sense and it works for other infections. So, yeah.
Great. Thank you so much, Dr. Schreiber. So I'm going to wrap us up. Before we go off though, I would love Dr. Schreiber to share any last thoughts that you have. So I'll give you a couple moments to share that if there's anything that you didn't say that you want to make sure that everyone hears. But before I turn over to you for that, some themes that I heard tonight, 2 things in particular. This is a marathon. So, you know, it's going to take time, but that consistency is as important as it is, you know, making a decision, but being consistent and continuing to move forward and continuing to, you know, mask and wash our hands and all of these things gets us a long way. And then the second thing that we heard you say a lot this evening is using common sense, thinking as much as possible about our decisions and having a focus of reducing risk as much as possible. So thank you so much for those messages that you shared, and would love to know if there's anything else you wanted to make sure that our group hears from you tonight.
Yeah, you know, I guess I would say, first of all, thank you. And I'd say any community group I talk to, I thank them. You know, we're blessed in that we live in New England. And the response to the pandemic, I know it's been rough. Of our family, it's been rough for everyone. But in general, people have pulled together. Most people are immunized. We care about our communities. We don't want our old people to pass away. And New England is the heaviest immunized part of the United States. And the pandemic here is subdued right now. It's not done. We haven't won yet, but it's subdued. And we're in the final few miles of this marathon in New England. And it's wonderful to watch. I'm proud actually to be here. I think the leadership in all of the states, whether you're a Republican or Democrat, you know, we've got a couple of Republican governors, I don't care. The leadership in New England has been really strong and people have followed the science mostly. And I think we're in a much better place. So I thank all of you out there for all the efforts that people have made. And I'm proud to be in Connecticut and New England. I fear that there are other states with that lack of common sense that are doing things that will prolong the pandemic and put us at risk again in New England if another variant comes and they're unimmunized and they're not on top of it. So we have to be vigilant. You know, the country is not performing as best as we would like, and other regions have a terrible problem with the pandemic, and most people have not been immunized in some of these states. So we're going to have to be vigilant. But right now, I think, Elizabeth, you know, you summed it up, common sense. You know, wait and try to get the facts. There's a lot of information out there. And I will say, Connecticut Children, if you have questions, push it through Elizabeth, and we will answer them. We really will. And no question is inappropriate. All of us have families, or we're parents, or we're grandparents. You are the advocates for these kids. It's important to have those questions. And it's our job to answer them as factually as we can. And if we don't know the facts, just say we don't know yet and be honest about it. So thank you for inviting me. And I know this has been recorded. If there are questions for people who watch it in the future, I would welcome them and I'm happy to answer them. And I'm glad to have been here. Thank you.
Wonderful. Thank you so much, Dr. Schreiber. And I echo the gratitude. Thank you so much for this amazing audience, for your participation, for your questions, for your presence. And thank you so much to Essex Library for having us. It really is a pleasure, both on the Connecticut Children side and the Hartford Healthcare side, to be here with you this evening.
Thanks again.
Well, I want to thank you all too. We're honored to have you and host you tonight. And thank you so much for all that information and so graciously given, with common sense being the primary factor here. So thank you everybody for coming in and joining us, and stay healthy.
Be well,
Take
everybody.
care.
Thanks again.
Thanks everyone.
Thank
Take
you.
care.